thing. I know. So this is what we're trying to do now as the Breathe Therapy Center, trying to go into corporations. Do you want to show a little bit, and we can talk about how we would go about doing this?
Mm-hmm. Okay.
There you go. So this is the latest invention in our Breathe Therapy services, because it was born out of a conversation in which it was I don't remember what it was a manager within a company that I was talking with, and she was saying, I don't dare have my Zoom meetings, or for sure not one-on-ones, because I'm going to have to hear all of the trouble that these people are having. And so then I feel bad asking them to do their job, because the job seems so less important than managing their personal lives. And so she actually didn't know that I was a therapist, and we were having this conversation. I don't remember where. And so I said, well, this is what I do for a living. So why don't you allow us to take care of those bits, and then allow you to, free you to do what you do best, which is to guide the company.
Right. So what you did very nicely there was point out that it doesn't need to be an either or, black and white.
Exactly.
And that the, situation where she felt like she didn't have the bandwidth or the heart or whatever, the skills to do both. Okay, nice clarification, and let's see what we can do about that piece, as opposed to it being, the flip-flop of this is bad, or one has to get
exactly. And so I like this. One of the reasons that I like this image was that, on the right you have this yarn that's all muddled up, and once she wraps it around, it becomes gears that fit into each other, and that allow things to move in a more organized kind of way. Do you want to put the other screen up?
Yes, please.
Might as well see that we're not necessarily inventing things, that there's some people who have used our services and think that there's something to gain from it.
Yes.
So we're hoping that this is an area in which we can continue to grow, of course.
Yes, and I think these testimonies speak to the point that, it's important to figure out what each person's role is and how to communicate their role within the system, whether it be the workplace or the family, in a transparent way, so that when there needs to be a shift, it can be done more smoothly.
Right.
Yeah.
And without anybody feeling like they have to pay the price and carry the whole weight on their shoulders. It can be a shared burden.
There we go. We're back away from the zero sum to a more productive place of interlinking gears.
Exactly.
Yeah. Wow. Because it is very overwhelming to feel like it's this or that, and there can't be some gray or way to work, and facilitate some growth and mutual.
Which then allows for new things to grow.
Right.
Yeah. I mean, do you want to go back to seeing our faces?
Let's do it.
So yeah, we're hoping that this is gonna work. But if you use sort of an agriculture metaphor, you got to prepare the soil before you put the seeds in. And once you've prepared the soil by asking questions, by listening to what hurts in this particular situation, then you can start to plant different plants and things and seeds, and they're more likely to grow than if you just sort of scattered things up in the air. It's much more purposeful, if you will. And that's what we can offer, because it's a case by case.
Right. And it's it's ironic to me that we call it brief therapy, because in the beginning it does feel like you're doing a lot of work, and it feels like you are, or at least I feel when I'm doing it, I'm really slowing down and looking at things with people in a way where we are just preparing the soil, we're not planting. And so it's always fun
Right.
to help people discover that the brief nature or the work being done up front allows for you to sort of more so reap the benefits of the crop when you prepare the soil properly and you sow
Right.
seeds properly, and then the rest of it is more brief. But
Exactly.
initial
Well,
stage is
so so more than brief. I think, you know, the founders of the model called it brief because in the 1960s it was in contrast to psychodynamic models, which took forever. So 10 sessions at the time seemed brief. I think as time has evolved, I think a more accurate description of what we do is the problem solving. And so that's why I actually call what we do problem solving, because it's brief as a consequence of all of the doors we don't open. We try not to go into the past too much because we assume, of course, that the person we're talking with is the sum of their experiences, the sum of their feelings in their lives. But we don't want to necessarily start with how did this problem start 50 years ago? Because that, by definition, you're going to open so many doors, which you're then going to have to close. So that is the definition of a long-term interaction with a therapist. And with the ethical almost dilemma that you potentially have the solution to what hurts, and you're extending it by opening up a bunch of doors that are in the past. I know somebody, you know, some people would find this very disagreeable for me to say, but at this point in my life, why not? I do say that it's brief because of all of the doors that we do not open. So we're going to choose very carefully which doors we're going to open. We want to mostly open the doors that are future facing and change potentially creating, because those are the ones that are going to be useful doors to open. So what do you do in the day-to-day to maintain this painful situation? The implication in that question is that when you stop doing those things that don't work, you're going to bring in change that is going to be beneficial. So yes, preparing the terrain by asking future-oriented questions is opening doors that you can then close. It's also instilling hope. And it's being respectful because you're listening to what hurts for this person at this time, or this family, or this corporation, or this group of people that you're talking with. Yeah.
I think we covered some good bases. Should we stop recording now?
Sure, of course. Okay.